Ever get that, like, little jolt of worry when you're about to have a medical procedure?
Oh, yeah.
Even if it's something pretty routine, you know?
Totally.
You start thinking, how do they even know if this is going to be risky for me? Especially if they're going to knock me out or something.
Right. Like, how do they size you up, make sure you're going to be okay?
Exactly. Well, that's what we're diving deep into this time.
We're tackling the ASA Physical Status Classification System. It's how doctors across the board, not just anesthesiologists, estimate the risk for a patient going into a procedure that needs anesthesia.
ASA, that's the American Society of Anesthesiologists, right?
Yep.
So they came up with this system, but you're saying it's not just for, like, major surgery anymore.
Not at all. It's used for anything where you might need anesthesia, whether it's full-on general anesthesia or something lighter like conscious sedation.
Okay, so why should our listeners care about this ASA thing?
Because it gives you a glimpse into what your doctors are thinking about, what they're considering, before they even touch you. It's like a framework for understanding your overall health in relation to the potential stress of surgery and the anesthesia itself.
So it's about safety, right?
Yeah.
Making sure they're tailoring the treatment to you specifically.
Exactly. Your safety and making sure the plan is right for you.
Like a peek behind the curtain at how they decide what's best for you.
Exactly.
So let's break it down. What are these ASA classifications? Like, what does this system actually look like?
Okay, so there are 5 main classifications. They go from ASAI, which is a normal, healthy person, all the way up to ASAV, which is, well, a very critical condition.
Okay.
So starting with ASAI, the official definition is a normal, healthy patient without systemic disease,
Systemic disease, meaning?
meaning a disease that affects the whole body, not just one spot.
Okay, got it. So ASAI, they're the picture of health, no major issues going on. What does that mean practically? Like, what can they handle? How do they usually do during a procedure?
Well, functionally, an ASA patient should be able to, let's say, walk up a flight of stairs or walk a couple of blocks on level ground, no problem, no shortness of breath or anything.
Okay.
And because they're generally healthy, they can handle the stress of, say, a dental procedure without any added risk.
Gotcha. So that's the baseline, the ideal patient. What about ASA3? What puts someone in that category?
The ASA3 is a patient with mild systemic disease. The key word there is mild.
Okay.
So they might have some health conditions, but they're well controlled.
Like, they're not completely sidelined, but they've got some things going on.
Right. They can still do some physical activity, maybe walk up those stairs or those blocks, but they might have to stop because of, fatigue or shortness of breath.
So how does that mild systemic disease affect how doctors think about a procedure for someone?
It's like a yellow light, Proceed with caution. Elective procedures are usually still okay because the risk is minimal, but doctors are going to think about whether they need to change things up a bit.
To minimize that risk.
Yes.
Makes sense. Being aware and prepared. What are some examples of things that would put someone in ASA 2? Anything that might surprise people?
Oh, yeah, definitely.
Fine on me.
Okay, so someone with type 2 diabetes that's well managed with meds and lifestyle changes, they'd probably be ASA 2.
Makes sense.
Same for well-controlled epilepsy or asthma, even thyroid issues that are under control with medication.
Okay.
And this one's interesting. A healthy pregnant patient is actually ASA 2.
Oh, wow. Okay.
And then there's people who are otherwise healthy but have allergies, especially if they've had bad reactions to meds before.
Right.
Oh, and even someone who's super anxious about, say, going to the dentist. Even if they're otherwise healthy, they could be ASA 2.
Interesting. So it's not just about having a disease, it's about how your body might react to the stress of the procedure.
Exactly.
And age. You mentioned age, right?
Right. Healthy folks over 60 and anyone with slightly high blood pressure, like 140 over 90 to 159 over 94, they're often ASA 2 as well.
Wider range than I thought. Okay, so ASA 2, it's about those pre-existing conditions, how well they're managed, and then things like age and anxiety all kind of factor in.
It's the whole picture. Yeah.
Got it. All right, on to ASA 3. This is where things get a little more serious, right?
Yeah, with ASA 3, we're seeing a bigger impact from that systemic disease.
So what's the defining feature here?
An ASA 3 patient has severe systemic disease, but it doesn't completely disable them.
Okay.
The thing is, they're usually okay when they're resting, but as soon as they're under some kind of stress, like during a procedure, or even just the mental stress of anticipating it.
They start having problems.
Yeah.
Okay, so what are some examples of conditions that would land someone in ASA 3?
Well, stable angina, for one. That's chest pain that comes on when you exert yourself,
Yeah.
but it's predictable. Also, someone who's had a heart attack or stroke more than 6 months ago and is now stable, they'd likely be ASA3.
Got it.
Then there's well-controlled type 1 diabetes, heart failure where they have trouble breathing lying down, and COPD, like emphysema or chronic bronchitis.
Oh, wow, that's a lot.
And there's more. Asthma that only acts up with exercise, epilepsy that's not as well controlled as in ASA2, or thyroid disorders where they still have symptoms. Those would all be ASA3.
Okay, so these are more significant health challenges.
Definitely.
What does it mean for treatment? Like, how do doctors approach things when someone's ASA3?
Well, elective dental care, for example, it's not necessarily off the table, but the risk is definitely higher than for ASA I or 2.
So extra caution.
Yeah, and doctors will really think hard about changing things up to minimize the risk.
Like what kinds of changes?
Maybe shorter appointments, different types of anesthesia, or keeping a closer eye on them after the procedure.
Makes sense. It's all about adapting to the specific situation. Okay, moving on. ASA fee, now we're getting into more critical territory.
Right. ASAP is a patient with an incapacitating systemic disease, and it's a constant threat to their life. Basically, their medical problems are much bigger than whatever procedure they might need.
That sounds very serious. What kind of conditions are we talking about here?
Well, unstable angina, for one. That's where the chest pain comes on, unpredictably, even at rest.
Oh, wow.
Or someone who's had a heart attack or stroke in the past 6 months. Very high blood pressure, like 200 over 115 or higher, would also be ASAP.
Okay.
Severe heart failure or COPD that needs constant oxygen or keeps them in a wheelchair, those are ASAP too.
Right.
And then there's uncontrolled epilepsy where they've needed to be hospitalized for seizures, and uncontrolled type 1 diabetes with a similar history of hospitalization for complications.
So these are folks with really serious, unstable conditions.
Yes.
And any procedure would be, like, super risky.
Exactly.
What do doctors usually do in these cases?
If it's an elective procedure, they'll almost always postpone it until the patient's condition improves, hopefully to at least ASA3.
Right. Makes sense.
But if it's an emergency, like a bad infection or severe pain, they'll try to treat it conservatively in the office, focusing on the immediate problem.
Okay.
But if they need more serious treatment, it's generally better to do it in a hospital where they have more support.
So priority shifts to managing that life-threatening condition first.
Absolutely.
Okay, and finally, the last category, ASAV. This is the most critical, right?
It is. ASAV is a patient who is moribund, meaning they're not expected to live more than 24 hours, even with surgery.
Wow, that's heavy. What kind of conditions fall under ASAV?
End-stage conditions, basically. Like end-stage renal disease where the kidneys have completely failed,
Yeah.
end-stage liver disease, end-stage cancer, end-stage infectious diseases, and end-stage heart and lung diseases.
So they're critically ill, and the chances of survival are very slim, regardless of what's done.
Yes, that's right.
It's hard to imagine even considering elective procedures for someone in that condition.
Yeah, the focus in those cases is really on comfort and palliative care.
Making them comfortable.
Right. Any interventions would be purely for life support,
Yeah.
and elective procedures just wouldn't be on the table.
Now, you mentioned earlier that there's sometimes debate about the line between ASASA and ASA3.
Oh, yeah.
What makes that boundary so tricky?
It's the whole how much the systemic disease affects their daily life and how much distress they experience. It can be subjective, Different doctors might see it a little differently based on their own experience and judgment.
Okay.
Like, imagine someone with well-controlled asthma that only flares up a couple of times a year.
Right.
One doctor might say they're ASA2, while another might say ASA3 because they're more worried about a severe attack happening under stress.
I see.
But the important thing is, whether it's ASA3 or 3-3, the doctor has recognized that there's more risk than for a perfectly healthy person, so they're not ASAI.
Right.
But they also believe the patient can handle the procedure, so they're not ASAFE.
So it's that middle ground where they're being extra cautious.
Exactly. It's a signal to be more careful and consider those treatment modifications we talked about.
So even if there's some wiggle room in how that line is drawn, the system still does its job, which is to flag when more personalized planning is needed.
That's the main takeaway, yeah.
It makes sense. Okay, so to sum it all up, this ASA physical status classification system, it's a really important tool.
It is.
It helps doctors quickly assess your overall health and the potential risks of a procedure, especially when anesthesia is involved.
Right.
And it helps them make the best decisions to keep you safe.
That's the goal. It's all about patient safety and making sure the treatment plan is appropriate for their individual health status.
And for our listeners, understanding this system, it gives you a better idea of what your healthcare team is thinking about and why they make the decisions they do.
It takes the mystery out of it, empowers you to be more involved in your own care.
Exactly. It all comes back to informed consent and making sure you feel comfortable and confident with what's happening.
Absolutely.
Well, I think this has been a really insightful deep dive.
Me too.
It's amazing how much goes into those decisions that we as patients often take for granted.
It's a complex process, but this ASA system really helps to bring some clarity to it.
It does. Now, for our listeners out there, I want to leave you with a question to ponder. Knowing how this ASA classification helps doctors assess risk, do you think it could help you have more in-depth conversations with your healthcare team about any procedures you might be facing?
Yeah, that's a good one.
Like, could it empower you to ask more informed questions and really understand the reasoning behind their recommendations?
Definitely.
Or thinking about all the different health conditions we've talked about, what other things beyond those ASA categories do you think might also play a role in a doctor's risk assessment for you?
It's something to think about as you navigate your own healthcare journey,
Yeah.
because it's not a one-size-fits-all approach.
Exactly. Everyone's different, and those individual factors matter.
Absolutely.
Well, thanks for joining us on this deep dive. It's been a pleasure, as always.
Likewise, always great to chat about this stuff.
And to our listeners, thanks for tuning in. Until next time, stay curious, stay informed, and stay well.
See you next time.